Hi, and welcome to Central Care TV, where we keep you up to date with the latest happenings in Houston.
Hello, I'm Sharon Moncrief, and I'm here at Central Care. Today, we're going to start our 6 weeks nutrition series. I'm standing here with Coach Flora Fifi. Miss Fifi, tell us what you have for us today.
Hello. Well, today we are going to do a smoothie, and this smoothie is on heart health. It's very important that we learn how to protect ourselves, and so this is simple, something that all of us can do. So we have quite a few ingredients, which is not that many. We have about 1, 2, 3, 4, 5, 6 simple things that you practically have in your house that you don't even have to go out and get. So, Miss Moncrief, what do you want to know?
Well, I see you have the spinach here on the table. I see you have apples and oats and the olive oil and water. Tell us how would this help us?
Okay, first we have spinach. It's very good for you. It's a green leaf vegetable. All of us should be eating spinach. Practically, we could eat it every day, even in a salad, because it has phytochemicals in it, and it has iron, and it does a whole lot of things that we wouldn't think with just a little green leaf. Okay, next we have the apple. It has pepsin in it. That is very good for your heart. Then we have oats, which will clean out your arteries. So many people have cholesterol and they don't really know what to do. They just, they do what the doctor said do, but this oats will clean your arteries. Plus, we have the olive oil. It's been fresh pressed, one press. It's not saturated, and it also helps your heart. So we're going to go into this today, and we're going to make a quick smoothie so that you can be healthy. You should take at least twice. I said 3 times a week, and I know you would be a step ahead. Okay, we're going to take the spinach. We need about 50% of spinach, and you just take it and put it into the little blender. You can have just an ordinary blender. You don't have to have a NutriBlend. So looking at this, that doesn't mean you have to have this. Then we can put in the oats, and that's about 1/4 of a cup of oats. And then we can go with the olive oil. That's 1 tablespoon of olive oil. Very simple, very simple. Okay, then we can do the apples. We can use 1 apple.
So this is 1 whole apple.
One
here.
whole apple, and
Okay.
this is an extra large apple. So if you have a small one, it doesn't matter, but this one's more of. As we do that, then we're going to put the water. And when you put the water in this machine, it only fills up to the max. So you don't do that very much. You pour in the water until you get to about almost 3/4 fill of it. Just about a little bit more. If you're in your blender, one thing about it, the more water you put into a smoothie, the thinner it be. The less water you put into a smoothie, the thicker it be. So if you want it kind of thick, you don't use as much water or milk, whatever ingredient that you're using, liquid. But this one we're using water. Then you screw the top on. It's very simple, and you're going to see that this is a very simple, healthy smoothie. This is health smoothie. It's not all that juicing and fruit and sweets. This is healthy. So we put it into it, and we do this. Okay, there it is. It's very liquid. You drink one of these the whole day long. All day long, drink it. And if you do it 3 times a week, you'll be in good shape.
May is National Stroke Awareness Month. Every 40 seconds, someone in the United States has a stroke, making it the 4th leading cause of death in the United States. A stroke, sometimes called a brain attack, occurs when a blockage stops the flow of blood to the brain, or when a blood vessel in or around the brain bursts. Strokes can and do occur in people of all ages. Strokes often lead to serious, life-changing complications that include paralysis or weakness on one side of the body, problems with thinking, awareness, attention, learning, judgment, and memory, problems understanding or forming speech, difficulty controlling or expressing emotions, numbness or strange sensations, pain in the hands and feet, depression. Lowering your risk for stroke. Demographic factors can all play a role in an individual's stroke risks. Regardless of your background, however, there are several things you can do to lower your chances of having a stroke, such as exercise regularly, eat a healthy diet that's low in sodium, maintain a healthy weight, prevent or control diabetes, don't smoke, limit your alcohol intake. Recognizing the signs of a stroke. When responding to a stroke, every minute counts. If you or someone you know exhibits the following signs or symptoms, call 911 immediately. Numbness or weakness of the face, arm, or leg, especially on one side of the body. Confusion, trouble speaking, or difficulty understanding. Trouble seeing in one or both eyes. Trouble walking, dizziness, or loss of balance and coordination. And severe headache with no known cause.
Thank you for watching CentraCare TV. Make sure you follow us on all our social media platforms: Facebook, Twitter, Instagram. Make sure to use hashtag CentraCareIHS. It's the best place to get all the new and current information on what we got going on in the city. It's the best place to find out what community events we got going on, where we're going to be giving on-site screenings, and the best place where you can see where we're going to be giving away giveaways and free food to you and your family. Come check us out.
I think it's an honest privilege to be part of CentraCare Community Health Center. It is really nice and refreshing to know each and every day when I go home, I contribute largely to relieving a lot of individuals of the healthcare disparities that they came in the clinic with. I believe that being in a position of management also allows me to interact with upper management in a way in which we can remain proactive, and we can remain very in a high level of technology to be able to continue to see these patients and afford them the same quality of care here that they do anywhere else they go.
My name is Vernon Lemon, and I think that what they're doing is a very good thing, and I think it helps them out for people that are having hard times like these during the holidays and stuff like this, where they can't afford to buy this. And I think it's good that they do drives to help give people what they need and stuff like that, and whatever care that they need too also. Just the last couple of like 3-4 months I've been coming. The ones that I've met here at CentraCare are very, very nice. They're very caring. I think what they do is great in helping with the project that they do. And the friend that works here I know does a lot of work in helping out with this, plus doing other stuff too, to help clients with what they need. And yes, I did get the test done, the blood pressure and the sugar test done, and it was free. There was no charge for that, and it was very well and good.
Melanoma Skin Cancer Detection and Prevention Month. Skin cancer is the most common type of cancer in the United States. Ultraviolet radiation from the sun is the main cause of skin cancer. UV radiation can also come from tanning booths or sun lamps. Types of skin cancer. Skin cancer is an abnormal growth of skin cells. It most often develops on areas of the skin exposed to the sun's rays. Skin cancer affects people of all colors and races, although those with light skin who sunburn easily have a higher risk. What does skin cancer look like? Actinic keratosis. These dry, scaly patches or spots are precancerous growths. Basal cell carcinoma. This is the most common type of skin cancer and looks like a flesh-colored, pearl-like lump or pinkish patch of skin. Squamous cell carcinoma. SCC is the second most common type of skin cancer and often looks like a red, firm bump, scaly patch, or a sore that heals and then reopens. Melanoma. Melanoma is the deadliest form of skin cancer and usually develops in a mole or suddenly appears as a new dark spot on the skin. Sun safety tips. Seek shade, especially during midday hours. Cover up with clothing to protect exposed skin. Wear a hat with a wide brim to shade the face, head, ears, and neck. Wear sunglasses that wrap around and block as close to 100% of both UVA and UVB rays as possible. Use sunscreen with broad spectrum. Remember to reapply sunscreen at least every 2 hours and after swimming, sweating, or toweling off. Fast facts about skin cancer. Unprotected skin can be damaged by the sun's UV rays in as little as 15 minutes. Yet, it can take as long as 12 hours for the skin to show the full effect of sun exposure. Even if it's cool and cloudy, you still need protection. UV rays, not the temperature, do the damage. Indoor tanning exposes users to UVA and UVB rays, which damage the skin and lead to cancer. A change in your skin is the most common symptom of skin cancer. This could be a new growth, a sore that doesn't heal, or a change in a mole.
Thank you for watching Central Care TV. Our professional staff and licensed physicians care about your good health. Our doctors are trained in the latest techniques and are devoted to providing quality services.
I think it's good to have the Central Care in the community for the people, because you have a lot of people in the community that does not have transportation, and it's easy access, easy for them to get to the doctor. Well, my sister's name is Rose Roach. Everybody up here knows her. The doctors have been real helpful to her. She gets her mammograms through this clinic, and all her healthcare services. I think it's very nice that they're doing this for the community, because we have a lot of poor people in the community that cannot provide food for their families, like during the holidays, and this helps them out. And it's everything that they're giving nutritious foods to the people. And we thank you for your services, because it's a big help.
Some of our services include dental, family medicine, senior care, pediatrics, physical exams, prenatal care, and well child visits. You can visit us at one of our many locations, as seen on the screen.
Thank you for watching Central Care TV.